Well, welcome everyone. This video we're going to go over the anatomy of LifeCare's outpatient therapy at home PT evaluation. These are sent to Optimotion through DocuSign, usually weekly, for your review as well as the doctor's approvals for these. On the top right of the page, basically just has patient name. We've created that actually as patient name, so it's a real patient, but changed the name on it. Birthday, has their diagnoses as well as some other information here. Also, if you look down on the bottom left of the page, you can see where the therapist has certified the medical necessity for this patient. The bottom right is where the doctor would also sign and date that they agree with the medical necessity and the care plan for this. This is a requirement by Medicare as well as ACA for all the insurances. We have to have these approved by both the referring physician and the therapist. So moving on to the second page, you can see where the therapy evaluation actually starts. Again, it's a reiteration of the patient name, date of birth, diagnoses on the right-hand side of the page. As we cruise down, each one, a piece of the eval kind of goes by different sections. Functional disability health evaluation. This is just an overall picture of the patient when we receive them. Data onset 6/16, that's usually the surgery date. In that case, it was surgery date. We're doing the eval on 6/17. Right TKAs, the diagnoses, functional treatment diagnoses, things that we're looking at: muscle weakness, fall history, limited activity, etc., etc. We'll go through each one of these, but impact, interview summary, patient's a 67-year-old female, right TKA, currently present with knee pain, weakness, limited range of motion, standing, balance, tolerance, affecting safety, independence, indoor-outdoor ambulation. So just a few more things about the patient. Again, this is more of an interview, what the patient looks like, the necessity. We focus on a few things here, specifically the comments and discussion. You can see PT plan of care to focus on the right knee, its range of motion, its strength, pain, but we'll also incorporate standing balance and tolerance to therapy to improve indoor-outdoor ambulation using no assistive device. Down here is probably where you guys will find things most important. Total number of visits 16. Juan is recommending 1 week 1 for the first week and 3 times a week for 5 weeks for the balance of the care plan. This is done on a Friday, so our Medicare week goes Sunday to Saturday. So we pick the patient up three times the following week. Date of the evaluation is the effective care plan date. Let's see some more important things. Things that we're going to be doing with the patient are Therex, gait training, home exercise. We're going to teach them how to change the dressing, neuromuscular re-ed, manual therapy, do some hot packs, that kind of stuff. So kind of moving on down here to the goals. This would be important for you. Total balance and gait score. Currently, they're at a high risk of falls with a score of 10. We want the patient to be at least 25 to 28 once we're finished with them, which would be great. We want that done by July the 29th. Ambulation aids currently with a walker. We want them to get to where they don't need the walker. Endurance, currently at 5 minutes. We want them to get to 30 minutes. Gait deviations, currently slow cadence, decreased heel-toe sequence, antalgic gait. We want them to get to a safe gait pattern. Other tasks: incision dressing change, currently distant supervision. On the day Juan saw the patient, they were able to complete the dressing change with him, basically distant supervision, just watching over them. We want the patient to be independent. That usually happens pretty fast. Knee range of motion, currently 10 to 90 degrees. For the right knee, we want to get to 120 degrees. We also want them compliant with their home exercise program. We're trying to get the knee strength from -4 out of 5 to a 4+ out of 5, trying to get their pain from 4 to 6 down to 0 to 2. So that's pretty much it as far as our PT eval goes. Pretty boring and simple. Again, the big thing for us is that we need a thing approved per ACA and per Medicare guidelines by Dr. Nguyen to sign and date that through DocuSign. Thank you so much.